My name is Sanuki Tissera. I'm a second year PhD student here at the Alfred Precinct. The health challenges that we're looking at are focused on lung cancer patients and the different characteristics or factors that influence patients receiving different types of treatment. At the moment, there are medical guidelines which are available to doctors to help them to make decisions on the best treatment for their lung cancer patients. Overseas research has shown us that patients that receive treatment according to these guidelines do have better survival rates. However, not much is known about survival and lung cancer here in Australia with regards to guideline treatment. So the aim of our research is firstly to actually identify how many patients here in Victoria receive treatment according to these guidelines. We also want to see what the differences are between patients that receive guideline treatment and those that don't. So these differences could be patient characteristics such as age or gender. It could be clinical characteristics, for example, the stage of cancer they're diagnosed with, or it could be hospital characteristics if they're treated at a public or private hospital. And finally, we want to see whether these guideline treatments actually improve survival for lung cancer patients. Our research involves using data from the Victorian Lung Cancer Registry. So some of the information that is collected includes patient details as well as the type of treatment they had, for example, whether it was chemotherapy, radiotherapy, or surgery. We took this data of around 14,000 patients and we looked to see how many actually received guideline treatment. We then did some statistical modelling to see what the differences were between patients receiving guideline treatment and those that received another type of non-guideline treatment. And finally, we did some further statistical analysis to see whether patients receiving guideline treatment had better survival. We found that the number of patients that have received guideline treatment has almost doubled since 2011. Patients that receive guideline treatment are more likely to be younger, never smoked, have an earlier stage of lung cancer, have been treated at a private hospital, and don't have any other diseases or conditions. Finally, and most importantly, we found that patients that receive guideline treatment have around a 15% higher survival rate compared to patients that received non-guideline treatment. Our hope is that this research will help to guide clinicians to make better informed decisions about the treatment for their lung cancer patients.